Type II hypersensitivity reaction now requires tissue-specific antigens and the production of IgG. What this means is that whenever there's a cell surface receptor and the allergen or the drug that's immunogenic binds to that cell surface, we now have a tissue-specific antigen. And when the body reacts with production of IgG, this IgG will activate the complement. This complement activation eventually recruits MAC, who's not of Scottish descent, is the membrane attack complex. And this will destroy the cell that's bearing the allergen or the drug that's immunogenic. This is called antibody and complement-mediated destruction because it requires the IgG and it requires the activation of the complement system. And it's not unusual to see it. We have the autoimmune hemolytic anemia. This is the way that the red blood cells are destroyed, but probably the one that's better known is the incompatibility of blood types when there's a blood transfusion that is not matched. This is the way that the antibodies from the patient are going to react to the red blood cells that are being transfused because they do bear an antigen that is not known to the recipient of the transplant. And in good pasture syndrome, what is being recognized is basically on the kidney. So these are different examples of type II hypersensitivity. Of the first one that we will review, it's the one that's complement activation. Type II hypersensitivity, which again we have the surface antigen and the IgG. In this case, with the antibody that engages the antigen on the surface, produces the expression of the complement with C3 expression on the surface of the target cell. This recruits macrophages, which cause phagocytosis. So this is another way that an antibody binding the surface antigen will produce killing of the target cell. And again, this can happen, for instance, in the incompatibility of the rhesus type blood group when the mother is negative and the child bears the rhesus antigen on the red blood cells. The mother antibodies will cross the placenta and produce the destruction of the red blood cells in the babies. This is mediated by antibodies. And the third subtype of type II hypersensitivity reaction, again, requires the surface expression and IgG. And in this case, when the antibody binds the allergen or the drug that's immunogenic on the surface, it will recruit peripheral blood mononuclear cells. These cells bear the Fc receptor, and that engages the IgG, and this will directly stimulate these cells into producing granzymes. These enzymes destroy the target cell. This particular reaction is relatively common because IgG is a very prominent antibody that we could produce against either drugs or allergens after a first exposure, especially in this type II hypersensitivity. And this is the way that we normally deal, for instance, with intracellular parasites or with neoplasms. It is called antibody-dependent cell cytotoxicity because it entirely depends on having an antibody and engaging the Fc receptor of the effector cells into producing the enzymes that kill the target cell. Now, this can also occur in drug immunogenicity, for instance, with epoetin. Epoetin will be a growth factor that stimulates red blood cells, but if the patient develops antibodies to the drug that are bound to the red blood cells, it can cause pure red cell anemia. And one of the potential problems with this is if the antibodies of the patient cross-react with the natural epoetin, then this is a condition that's called in-cross reactivity, and it would be a serious adverse event of treatment with endogenous proteins. This is just one example, but it could potentially occur with your biologics that are endogenous proteins. Drugs as haptens also use this mechanism to produce the hypersensitivity type 2, and finally a lot of drug-induced anemia, thrombocytopenia, or neutropenia. So in this case, it is very important you understand what is the target cell of the drug that you are using for your patients. And if you understand what is the target cell, you can see if the reaction the patient is presenting with may be due to an immunogenic response to the drug. In this case, type II hypersensitivity. The recommended references are attached, and I hope you enjoy and subscribe to my channel. Thank you.